Hello and welcome to Southern California MD Magazine. I'm your host, Dwight Cromie. On this episode, we'll be talking to Jenny Pricer, Director of Maternity Education at Parkview Community Hospital. Parkview Community Hospital, for the past 50 years, has been providing quality, compassionate health care to the citizens of Riverside and surrounding communities. As the only nonprofit hospital in Riverside, they are devoted to serving the healthcare needs of the growing community through all stages of life, from newborns to seniors. Welcome, Jenny. What exactly is a lactation consultant? I'm not quite sure what that is.
A lactation consultant is a person who has gone through specialized training. We are board certified, and this enables us to provide up-to-date information and support to moms in breastfeeding.
And I understand that Parkview recently was designated as a baby-friendly hospital. What does baby-friendly hospital mean?
Well, Baby Friendly is a global organization sponsored by the World Health Organization and UNICEF, which recognizes hospitals that provide an optimal care of breastfeeding for mothers and babies. We are one of 121 hospitals that have earned this designation. That represents only about 5% of hospitals in the nation.
How difficult is it to get this designation, and what is the process?
Well, for Parkview, it was a 3-year process. There are 10 steps that Baby Friendly has come up with in conjunction with the World Health Organization that help moms be successful in successful breastfeeding. Parkview developed policies and procedures in the hospital to support breastfeeding mothers, and we were actually surveyed by a team of 2 people which came out and surveyed us after we had demonstrated that we were ready for that survey. We had to supply our breastfeeding statistics and policies before they would even come out. After 2 days of survey, during which time they actually surveyed physicians, nurses, and patients, they took the results of their survey back to another independent board who reviewed those results and determined that we were in fact deserving of a baby-friendly designation.
What does that mean to moms? What does baby-friendly mean to that mom or parents?
Well, what it means is that they're going to get support in providing the best for their babies. And Parkview for a long time has had a tradition of providing the best for babies and the most up-to-date practices. Baby-friendly practices support the optimum feeding for babies, which also benefit mothers. We know that breastfeeding not only contributes to health during infancy, but continues on throughout that child's life and also benefits the mother. And Parkview recognizes its role in that cause.
Did you get assistance in getting this baby-friendly designation? Was there another organization like First 5 involved at all?
Yes, First 5 provided some funding for us, as well as Parkview, to fund the process of becoming baby-friendly.
Jenny, can you tell me what is the difference for a child, or what does it do to a child that is breastfed versus one that is not?
Well, babies that have any breastfeed, but especially babies that are breastfed for a minimum of 6 months, which is the recommendation from the American Academy of Pediatrics, benefit from breastfeeding in many ways. They're less likely to be obese as adults. They have a greatly reduced incidence of sudden infant death. They have less upper respiratory infections, less asthma, and less allergies in the first year of life. So it's really, really important that they receive the optimum feeding, which is mother's milk. But it also benefits mothers too. A study 2 years ago showed that mothers who breastfeed for a minimum of 6 months have a greatly reduced incidence of heart disease, which is the #1 killer of women today over 50 in our country.
So it's really important then.
Very important.
And what are some of the baby-friendly practices that you're applying at the hospital?
Well, our baby-friendly practice begins at birth. Babies after delivery are placed skin to skin on their mother for what we call the golden hour. And this not only benefits them physiologically and emotionally through bonding, but also is a great time for them to be introduced to breastfeeding. And we know that a successful first breastfeeding session contributes to successful breastfeeding later on. After the babies are given that first hour, they remain with their mother throughout the remainder of their stay and are not separated. And this gives moms the opportunity to have uninterrupted access to the baby, which also contributes to breastfeeding success once they leave the hospital.
Can you tell me what other aspects of your maternity program at Parkview are helping parents?
Well, we offer prenatal classes to everybody in the community, and all of those classes do mention and instruct about breastfeeding. During their stay, we do have a staff of board-certified lactation consultants 7 days a week. Additionally, we encourage family-centered care at Parkview, which allows a support person to remain with mom during the entire stay. And this is great support for breastfeeding and great support for our new moms. Parkview is known for that specialized care. We can offer that even though we're a small hospital, while also offering the services of a much larger hospital, including a level 3 NICU and highly specialized doctors who are also baby friendly. This means it's good news for Parkview, but more important, good news for babies.
That's great. Can you tell me, I understand the hospital has done a variety of other things to make it much more baby friendly, new birthing rooms and other things. Can you tell me a little bit about that?
Yeah, we're in the process now of updating our maternal-child health unit. We have state-of-the-art LDR rooms. We also have 2 dedicated cesarean rooms on labor and delivery, and this is also a very baby-friendly practice. Even moms that have cesarean deliveries have the benefit of recovering on the unit, which enables them to have that very important bonding first hour with baby also, and breastfeeding support immediately following their surgery.
So it sounds like Parkview has really gone the extra mile to be a hospital that really cares for families right at the beginning, right at being a newborn, correct?
Oh, absolutely. We recognize the specialness of that moment, and not only are dedicated to helping moms have a safe and healthy delivery, but a rewarding one also, a rewarding experience.
Now, I understand that one of your pediatricians actually created a video for helping moms learn about lactation consultants, both in English and Spanish. Have you been applying that video, and how successful has that program been?
Well, we have begun showing the video, especially during nighttime hours where sometimes we don't have a lactation consultant immediately available. And many of our moms are Spanish speaking, so by providing a video both in English and Spanish by one of our particularly breastfeeding friendly physicians, it gives them sometimes the extra motivation to breastfeed and to ask for assistance from the nurses if they need more help.
Well, Jenny, I want to thank you for spending the time with me, and it sounds like Parkview is doing everything right.
Thank you.
In addition to their baby-friendly recognition, Parkview Community Hospital offers a 24-hour emergency services and critical care. The hospital has received a 5-star health grade recognition for many of their services, including maternity services. They have several centers of excellence, including weight loss surgery, a joint replacement center, and a level 3 neonatal intensive care unit. With over 450 physicians and 900 employees, their healthcare professionals use the latest technology and equipment while continue to focus on the most important part of healing, the human touch. I want to thank you for watching this edition of SoCalMD.